Alrighty, hi John, how you doing today? My name's Tucker, I'm a student physical therapist. Today what we're going to be doing is just going to be palpating a bunch of different structures just so we can see if anything's bothering you. So in order to do that, I'm going to have to place my hands on your body to feel these structures. Is that okay with you?
Yeah, that'd be fine.
Alright, so to start, we're going to start here on your lower back. So I'm going to have to lift up your shirt and slightly lower your pants so that we can feel some structures. You okay with that?
Yeah, that'd be fine.
Yeah, alrighty. Bring that up. I'm going to take these and roll these down just a bit. Okay, so the first structure we're going to find is the PSIS, posterior superior iliac spine. In order to find that, I'm going to find the top of the iliac crest. I'm just going to trace those backwards until I find the PSIS. So the PSISs are right there. And what's important about these is it's the bony level of S2. And as well from this, we can go down and we can find the inferior lateral angle of the sacrum, which is the next structure we're going to find. So I'm going to follow that down. Careful not to let my hands disappear. We're going to find that right there. So that's the inferior lateral angle of the sacrum. What's important about this is it's roughly the level of S4, but as well you have the sacrospinous ligament and the sacrotuberous ligament that come off of this. We could follow the sacrotuberous ligament down to our next structure, but I'm going to find it a different way. I'll pull these back up. John, I'm going to roll up your pant leg. Is that okay?
Yeah, that'd be fine.
Okay. I'm going to roll this up, right, so we can get to the gluteal fold. And then what we can do here is right at the gluteal fold, we can just push up and in, right there. We can find the ischial tuberosity. So what's important about this is you have the origin of the hamstrings, as well, like we said before, the sacrotuberous ligament comes down and attaches there. So we're going to lower those back down. Put this back. And so the next structure is the L5 spinous process. So what I like to do is I'm going to find those PSISs again. And like we said, that's bony level S2. I'm going to go over, find the S2 spinous process, count up S1, count up again, L5. So the L5 spinous process, right, it's right superior to the lumbosacral junction, and as well it's a very common site for low back pain. So if you apply some pressure there, you can see if the patient is having any issues with low back pain. And then to find the next structure, I could count up all the way up to T12 to find the 12th rib, or I can go in from the side. So I'm just going to count. So we got L4, L5, L4, L3, L2, L1, T12. Right there you can feel the 12th rib, or you can come into the side to feel the ends of the 12th rib and feel that it's a floating rib. What's important about this is, especially if you have it in the sideline, you can feel the quadratus lumborum muscle, or you can use it as a landmark to slide off of and feel the kidneys down below and palpate for the kidneys. Alrighty, John, we're going to continue with our palpation. So we're going to start with the liver. So for the liver, I'm going to have to reach across you for the video here, but we're going to find the inferior border of the ribs. We're going to tuck our fingers right down inside, and I'm going to ask you to breathe in deep for me. So with deep inspiration, you can feel the liver a little bit better. But the liver, a normal liver should not feel tender, and you should not feel great detail to it. So that's with the liver. We're now going to move down to the anterior superior iliac spine. So I'm going to roll your pants down a little bit. Is that okay?
Yeah.
Okay. So we're just going to go on the one side. So we're going to find the superior border of the iliac crest, and we're going to trace that down to the anterior superior iliac spine. What's important about this is it's the attachment for the sartorius. As well, you can follow just inferior and find the anterior inferior iliac spine. And then, so we can follow the sartorius, and I'm going to roll up your pant leg. I'm going to bring his leg up over here to find the medial femoral triangle. And I'm going to ask him to apply pressure against my hand right here. That way we can find the adductor longus, and we can find the triangle perfectly right in there. And there you can find the femoral artery as well as the femoral nerve. And from there, I'm going to have John roll onto his right side for me, if that's okay. So on the right side, we're going to find right here, we can go with the palm of the hand to find the greater trochanter, which is right here. So on the greater trochanter is the attachment site for the piriformis, as well as it's a common site for hip pain, so you can palpate that to feel some hip pain. And then John, I'm going to go ahead and have you sit on the edge of the table for me so we can feel the rest of these structures. Maybe scoot up a little bit. Okay, and then we're going to go right off, and we're going to find the occipital protuberance, and we're going to go right down until we feel the first vertebrae right there, and that would be the C2 spinous process. And what's good about the C2 spinous process is it's good for orientation for the rest of the cervical vertebrae. As well, if we put his neck into flexion, you can feel the nuchal ligament there. The next one is the C6 and C7 spinous process. I'm gonna find the one that pokes out the most, and then we're gonna go one vertebrae just in front of it. I'll have you flex and extend your neck. Okay, and that did not disappear, so we gotta go one more up, and that one does disappear with the extension. So that would be the C6 spinous process. So the one below it is the C7. What's good about these ones is it's good for orientation for the rest of the thoracic vertebrae. And as well, if we roll off just lateral, you can find the facet joints and the articular pillars, which is what we're going to be finding next. So we're going to roll off just lateral. And this one, once you find the articular pillars, they're kind of a little harder to feel just because it's the gutter for the paraspinal muscles. But so not only is that important, but another thing about it is if you roll off just anterior, you can feel the transverse processes of the cervical vertebrae. I should be doing it on this side. And after that, on our list, we have the first rib. So for the first rib, we're going to palpate down through the trapezius to find the first rib. And once we find it, you can trace it anterior, and you can find the attachment points for the scalings, and as well the costosternal-sternocostal articulation, which is just under the head of the clavicle on the anterior side. Alrighty, John, we are going to continue with the palpation here through your shoulder and down your arm. I'm going to place my hand on your shoulder. Is that okay?
Yeah.
Okay, so we're going to start here with the acromioclavicular joint. So you can find it either by following the clavicle laterally or finding the acromion and finding the bump where they meet up, and that's the acromioclavicular joint. It's where the acromion and clavicle articulate, as well as it's where shoulder separation happens when you're falling down on your shoulder. So if we take that and we follow and find the acromion, we can find where it turns into the spine of the scapula, and we can fill the spine of the scapula as we go back towards the backside. On top of the spine of the scapula, we have the supraspinatus muscle, and below we have the infraspinatus muscle, as well as the spine of the scapula. Once you meet the medial border of the scapula, it's about the level of T3. And then we find that medial border. We're going to follow it down all the way to the back until we find the inferior angle of the scapula. The inferior angle of the scapula is important because it has the teres minor that attaches there, the teres major that attaches there, not minor, as well as the latissimus dorsi. So if we come back up here, I'm going to find the acromion, and then I'm going to roll off the side of the acromion to find that subacromial space. So the subacromial space is a good location to be able to find the rotator cuff muscles if you feel around in there, as well as there's a bursa in there that can be a site of bursitis and some inflammation and some pain. And then if you come off of that and roll around, we're going to take our palm and we're going to find the greater tuberosity of the humerus, which is right there. And this is an important spot because it's the attachment for the supraspinatus muscle, as well as the lateral border of the intertrabecular groove. So if you roll off that into the intertrabecular groove, you can feel the tendon of the long head of the biceps. So then after that, we're going to come back up to the acromion to find the clavicle. Acromion to find the clavicle. And on this lateral curvature of the clavicle, if we roll down in there with our fingers, we can feel the coracoid process. So the coracoid process is important because it's the attachment for the pectoralis minor, the short head of the biceps brachii, and the coracobrachialis muscle. The next structure we're going to find is we're going to come down here to the elbow. So if we find the cubital crease right here, if we roll onto the medial side, you can feel, we use our palm right here, you can find the medial epicondyle of the humerus. This is important because it's the common origin for the wrist flexors, as well as if we roll off of that a little posteriorly, you can find the cubital canal, which is where the ulnar nerve runs. So if we go back to the cubital crease and follow it laterally, we can find the lateral epicondyle over here. And that's important because it's a common origin for the wrist extensors. As well, if you follow that down, you can find the radial head, so it's a good place to find that, which is our next structure, is the radial head. So we're going to take the radial head. Once we find that right about there, you can find it on the posterior side, and if you push through on the anterior side, you can get a hold of the radial head, and you can fill it with pronation and supination of the wrist. So it's a good spot for that. As well, you can feel the joint space just proximal to it, and this is also a common area. Well, nursemaid's elbow in children typically happens here with a little joint dislocation separation. Then we're going to go down to the wrist. We're going to start with a scaphoid bone. So I have John extend his hand like this, and we can see the anatomical snuff box here, the really good one right there. And the scaphoid bone is just in that, which is between the extensor pollicis longus and brevis tendons. The scaphoid, it's important to be able to find because the common site of fracture for falling on an outstretched hand or floosh. As well, the radial artery comes down and wraps back up into that anatomical snuff box on top of the scaphoid. And then our last structure for this section is the triquetral bone, which we find the styloid process of the ulna right here, and we roll off of that. You can feel the triquetral bone pretty prominently right there, and with the radial and lateral deviation, you can feel it disappear and appear and become more prominent. And that's important because if you follow that anteriorly, you can find the pisiform bone. And the pisiform bone, if you wrap your finger around it, you can find the hook of the hamate. And between those, it forms the tunnel of Guillain. And in there, you can find the ulnar artery and the ulnar nerve. Okay, John, the last structures we're going to be palpating are around your knee and down into your ankle. So is it all right if I place my hands in those locations?
Yeah.
Okay, so we're going to start with the knee joint line. So if we find the patella and then find the patellar tendon coming off of that, if you slide off medially or laterally, you have the medial and lateral joint line. And it's important to be able to find these because you can feel the medial meniscus and the lateral meniscus if we have him rotate his foot back and forth. And as well, if you follow that joint line medially, you can find the medial collateral ligament. And if you follow it laterally, you can find the lateral collateral ligament. And then the next structure is the fibular head. So if we take our palm right here and we roll around, we can find the fibular head. And it's important for this because it's the insertion for the biceps femoris tendon as well as the lateral collateral ligament. And the next structures we're going to be finding are down here on the ankle. So the first one is the talus. So if we take the medial and lateral malleolus right here, right in between those structures of the talus. So if I have a plantar flex and dorsiflex back and forth, you can feel the head of the dome of the talus moving around. And this is important because you can feel the neck of the talus below that, and it's a good spot to be able to find the sinus tarsi, which is where the ATFL, the anterior talofibular ligament, is at. So just on the lateral side of that is, I know this is an awkward angle, we're going to come down here, is the sinus tarsi, which if we go into this structure, if I have him plantar flex and invert, you can see the sinus tarsi open up and the ATFL is in there, which becomes taut with plantar flexion and inversion. And as well, it is the most commonly sprained ligament in the body, in the ankle. So it's important to be able to find that. The next structure we're going to find is the base of the fifth metatarsal. So if I take my hand right here along the side of the foot, you can feel the base of the fifth metatarsal sticking out. And that's important because you have your adductor digiti minimi that comes and attaches onto there. As well, if you roll off of that structure, you can find the cuboid bone. And then on the medial side, the last structure is the navicular tuberosity. So if we find the medial malleolus and we roll off anterior or distal and a little bit inferior, we take our hand, usually the most prominent protuberance right here, which is right here, the navicular tuberosity. And that's important because it's the attachment for the spring ligament as well as the posterior tibialis tendon.